Bismillah. This is a little bit of a talk about colonic polyps. We'll start with hyperplastic polyps today. So hyperplastic polyps are basically the most common polyps. They are 3 to 10 times more than adenomas, and they are asymptomatic, and most usually they do not develop into cancers. There are things that we need to be aware of, such as familial adenomatous polyposis and other genetic syndromes and adenomatous polyposis diseases that can increase the risk for those patients. The gross features of this hyperplastic polyp is that it is usually in the sigmoid and in the rectum, usually multiple, not just one, and you'll find that it is small, of about less than 0.5 centimeters or 5 millimeters. The larger ones and those of different locations must be distinguished from sessile serrated polyps, as you'll find both sessile serrated polyps and sessile serrated lesions, which is the same thing, but lesions is the better name for now, as updated by the WHO. The hyperplastic polyp is a serrated sawtooth luminal border on histology, where we'll find mature colonocytes, which are basically the enterocytes, the columnar epithelial cells that are in there. There are more of those per unit. As the name suggests, it's a hyperplastic condition where there are more proliferation of the cells. Now, the important thing to remember is that there is this no bottom-up atypia. Apologies, it's actually bottom-up atypia, where you'll find that the bottom part of the crypt is actually mostly where these proliferation centers are active. So they call it atypia. However, you will find no dysplasia, because if you do find dysplasia, then it becomes an adenomatous polyp, okay, or a sessile serrated lesion. Whatever it is, that is in the specific definition of hyperplastic polyps. There is no dysplasia, okay, and also the number of the goblet cells and the enterocytes, the absorptive enterocytes, is normal. It is the same. So the association between those two does not really change, if you can see it well here. Okay. Then you have this wider upper half of the surface crypts. What does that mean? That means if you look at any of those crypts that are on the surface, not these crypts which are the tubular type of the crypts, no, but these on the surface, you'll find that they are wider at the upper half. So again, the lower half is full of proliferation area, so there are more mitoses occurring Okay, and the top half is wider. That's your distinction that you can remember. And it's very difficult, but those are basically hyperplastic polyps. They are smaller, they are benign, they do not develop into cancer, but we need to be careful to distinguish them from adenomatous polyps and sessile serrated lesions. And these are the rest of the polyps that we'll discover later on.